Hello, I'm Juan, your assigned student nurse for the day. A 35-year-old female patient who suffered from diverticulitis for 1 week decided to undergo temporary colostomy. A colostomy is a surgical procedure that brings one end of the large intestine out through the abdominal wall. During this procedure, one end of the colon is diverted through an incision in the abdominal wall to create a stoma. A stoma is the opening in the skin where a pouch for collecting feces is attached. People with temporary or long-term colostomies have pouches attached to their sides where feces collect and can be easily disposed of. As the nurse on duty, what are your nursing responsibilities before the procedure? Ask patient regarding her current medication. The patient may need to stop taking medication a week before the procedure. If the patient was taking aspirin, ask the physician if the patient needs to stop taking blood thinners. Educate the patient regarding anesthesia options, including the risk, benefits and alternatives. Advise patient to take laxatives to empty bowel before procedure. Advise patient to have a healthy diet. Do exercise and be active. Avoid alcohol and tobacco. Advise nothing per order or NPO before the day of procedure. Most important of all, secure the informed consent before the procedure. Inform and explain to the client the procedure. After 6 hours in the OR and PACU, you receive the patient again, but this time that patient is post-operatively with temporary sigmoid colostomy attached in her abdomen. What are your nursing responsibilities post-operatively? Educate patient regarding the diet plan. Ice chips are given for the first 24 hours to ease the thirst and followed by clear liquids and eventually soft foods. Assess for patient's bowel sounds. This was the sign that the patient may begin to soft diet and may be ready to discharge. Teach patient how to use colostomy bags. A colostomy bag is where the feces will collect while the patient have colostomy. If the patient is for discharge, advise the patient regarding follow-up appointment for the physician to check the patient condition and colostomy. Caring for colostomy. Use the right size pouch and skin barrier opening. An opening that's too small can cut or injure the stoma and may cause it to swell. If the opening is too large, output could get to and irritate the skin. In both cases, change the pouch or skin barrier and replace it with one that fits well. Change the pouching system regularly to avoid leaks and skin irritation. It's important to have a regular schedule for changing your pouch. Don't wait for leaks or other signs of problems, such as itching and burning. Careful when pulling the pouching system away from the skin and don't remove it more than once a day unless there's a problem. Remove the skin barrier gently by pushing your skin away from the sticky barrier rather than pulling the barrier away from the skin. Clean the skin around the stoma with water. Dry the skin completely before putting on the skin barrier or pouch. Watch for sensitivities and allergies to the adhesive, skin barrier, paste, tape, or pouch material. They can develop after weeks, months, or even years of using a product because you can become sensitized over time. If your skin is irritated only where the plastic pouch touches it, you might try a pouch cover or a different brand of pouch. A stoma nurse can offer ideas if needed. Pouch covers are available from supply manufacturers, or you can make your own. You may have to test different products to see how your skin reacts to them. How will you provide nurse-patient interaction? Introduce yourself to your patient and use her name while talking with her. A handshake at your initial meeting is often a good way to quickly establish trust and respect. Make sure your patient has privacy when you provide care. Be sure that her basic needs are met, including relieving pain or other sources of discomfort. Actively listen to your patient. Make sure you understand her concerns by restating what she has verbalized. For example, Mrs. Miles, you mentioned that you were concerned that your bone pain won't be addressed in a timely manner. However, don't use restating too much in the conversation because it can be perceived by your patient that you weren't really listening to her. Be real, showing your genuine self when communicating with her. Maintain eye contact. Remember, too much eye contact can be intimidating. Smile at intervals and nod your head as you and your patient engage in conversation. Speak calmly and slowly in terms that she can understand. Your voice inflection should say "I care about you." Maintain professional boundaries. Some patients need more therapeutic touch, such as hand-holding and hugging, than others, and some patients prefer no touching. Always respect differences in cultures.